All right. Good afternoon, everyone. My name is Lauren Schimmel, and I'm the Director of Healthcare for doForms. Thank you for joining us for our second session on our Mobile Transformation Day. This afternoon session is going to be on caregiver scheduling. So this is very applicable to those of you in the home healthcare sector. We'll be really talking about our solutions to help you manage the schedule of your caregivers as they're out in the field traveling around doing their day's work. Just a little housekeeping before we get started. I did want to point out that in our webinar, there is a Q&A button. So if you have any questions or if you have any ideas that you'd like to share throughout the course of this presentation, please just pop it in that Q&A chat. We'll be able to address those questions. I'll also be providing my email address. So if you want to reach out to me directly, I'm really happy to take those inquiries one-on-one. I'd also like to give a shout out to my associate, Lauren Collis, who is here helping me out with all the technology today. She is a gold mobile solutions consultant here at doForms, and thank you, Lauren, for your help as we get this going. So I hope everyone's had a good morning so far. I hear we've had an excellent keynote by our CEO, and we just wrapped up our last session on the healthcare track, talking about our advanced security settings. So if you're just getting the chance to join us right now, just a quick recap. doForms does help healthcare organizations with their mobile data capture requirements. And we provide a platform that has HIPAA compliant security controls just to ensure the end-to-end protection around all of your data. So we'll definitely have that session available. If you didn't get the chance to review it, if you're still with us, thanks for coming along. So now let's get right into the topic at hand, which is caregiver scheduling. So in a traditional sense, maintaining someone's schedule is pretty easy. doForms, if you're familiar with our product, actually has a dispatch scheduling feature. And this works great in the traditional workflow world of most businesses. Someone gets a call in, there's a job that needs to be done. We dispatch a work order to a technician in the field, and boom, they can get to work. They receive an alert on their tablet, they have all the information about the job they need right there, and they're able to do that task. In healthcare, specifically the home healthcare sector, this gets turned on its head. Caregiver scheduling is a highly complicated, highly difficult challenge for home healthcare agencies to automate. And it's something that we've been approached by, and we have a solution that is very unique in the industry and also solving a lot of these challenges and making things more visible and more efficient for home care agencies. So that's what I'm going to be showing you today. But to set the stage a little bit, I want to talk about why is this so complicated? Okay, let's talk about home health care. I am an agency. I provide skilled nursing care to my 100 patients that I have in my community. Maybe each patient has 2 to 3 caregivers that see them throughout the course of the week. So you can imagine now, all right, having to manage 300 visits. It starts to multiply. Now, on top of that, the caregivers themselves, the nurses, they are the ones who have to make the decisions about who they're going to see and when. So while the agency has the ability to say, all right, Mr. Joe Smith, you have been eligible for 3 visits a week, an hour long, you can be seen for 3 hours. It doesn't tell them when and exactly where. That's really up to a very unique dynamic between the caregiver and the patient to sort out what works best. Now, there's actually been studies done because this is such a complicated issue in the home healthcare sector. Basically, the nurse has to figure out what their work schedule is going to be, but then also manage specific patient and agency factors. And then they have to overcome unpredictable things that happen. Maybe someone falls and goes to the hospital. Oh my goodness, that throws everything off. So there's so many factors that can go on that make caregiver scheduling a very complicated challenge. And we'll talk about why this has significant business impact as well. Now, the study that I mentioned, they actually exposed 4 themes that make caregiver scheduling in the home healthcare sector so complicated. So the first is the nurse has to decide, okay, of all of my patients, what are their needs and what is the particular acuity of any given patient? Is someone more serious, in more serious shape? They need to be seen more quickly. Can someone wait till later in the week? You know, how do I balance that across my entire caseload? And then there's, of course, preferences. You know, Joe likes to go for a walk in the morning. He won't be at home until that afternoon. Or he does not want to be seen on Wednesdays when his son comes to visit him. So there's personal preferences that go into managing and creating these schedules as well. Then, of course, you have to coordinate visit timing with other providers. So let's say Mr. Smith is also being seen by a physical therapist or a speech therapist. You don't want to overlap visits. So now you have, you know, even a third party having impact onto when you can actually go and make these visits. And then, of course, there is the pressure to make sure that you are being productive, you are doing the visits that you are being paid to do, that you're meeting your own productivity requirements. So travel time, visit count expectations. So all of these factors play in to make a very, very complicated situation for home healthcare scheduling. And you can see quite quickly how that traditional, I'm going to get a call and send a job out, dispatch model doesn't really work. So what happens? What's the status quo? So right now, autonomous scheduling, there's little room for full visibility and insight across the board because most caregivers, they're having little day planners. They manage their cases on a day-by-day, maybe a week-by-week basis, but mostly it's set the night before. They're using paper calendars, their personal devices, their Outlook, all of their kind of personal tools that they have to manage what their daily schedule is going to be. Then they call in, they report, and they manage that as they go on. So even for the smaller agencies, you have hundreds of visits going on, and the agency itself, the central office, has no idea of consistency, visibility. There's no real-time updating. Did the visit happen or not? Really, everybody's just kind of moving along in an autonomous way, hoping that everything, goes smoothly when typically it doesn't. and it's just a lot of moving parts going on. And on top of that, you're running a business. So, at your office, your phone is ringing and you have your clients calling in asking, when is my nurse supposed to arrive? My mom called, she hasn't seen her. I need to reschedule a visit. I can't get a hold of her. Who do I call to take care of that? And my caregiver hasn't shown up yet. Are they still coming? Or, what's going on? So all of these questions that come in, and there's no visibility. There's no action. The person answering the phone can't see Susan's personal day calendar. So it's very difficult because, no visibility, no answers can be given. And from a business perspective, that kind of looks like you don't know what you're doing. Unfortunately, it's just the case. And you want to be able to provide adequate response. You want to be able to help people. You want to be able to deliver that top quality service. So our solution, what I'm about to talk to you about, really helps you do that. And it's very exciting because we kind of took that idea that we needed to put the power of the schedule into the hands of the caregiver and built an entire process for this. And I just want to say, while we've deployed this for many customers already, this is a solution that we can deploy for you. It's out of the box, it's ready to go. You could turn this on, within the next day, be receiving your caregiver scheduling this way. So let's talk about what we call the doForms self-scheduling solution. So like I said, we've turned this around. We've turned typical scheduling around. And what we do is we provide a custom mobile app. It'll have your agency's logo on it. And there's going to be a nice icon on the app that says Create Daily Schedule. When that opens up, it's going to automatically populate with your name so they know who the caregiver is. And then you'll be asked a series of questions. Okay, what is the date of the visit? So in most cases, it would be tomorrow. These are the visits I'm going to do tomorrow. And then we have a nice drop down where you select the patient that you're going to be seeing, the type of visit that you're going to be doing, whether it's a start of care visit, just a typical visit, maybe you're doing physical therapy, whatever you're going to do. And then you select the start time, your envisioned start time or your window, and then how long you expect the visit to last. Then you fill out this nice little schedule and then you hit submit. And immediately as you hit submit, doForms is going to take each of those rows in the schedule that you've outlined and create on a centralized calendar back in the office on our portal, a view that's going to show you exactly what day, what time, who you're going to be seeing, so that by nurse, the agency now gets that immediate visibility into what they think they're going to be doing. And of course, things can go wrong, and we have contingencies for that. So nothing's set in stone, but this does just give you a giant leap forward in knowing where your caregivers are going to be, who they're going to be seeing, and when they're expected to be certain places. So it's vastly better than the manual process that's out there today. Now, simultaneously, as soon as the caregiver submits that form that creates the jobs on the calendar, we're also sending back to their tablet a job list, a nice little queue. And that queue consists of what we call visit confirmation forms. So as soon as they actually go there and make the visit, they can open that form and they can do certain things. They can say the visit was a success, the visit was canceled, the patient didn't open the door, the patient asked to be rescheduled, the patient went to the hospital, whatever those statuses are, you then can enter that into the visit confirmation form and submit real-time status updates back to the central portal. So now all of a sudden you have visibility into what's going on. Maybe someone's running late. So if they get a call, they can say, oh, you know, Jane's running late at another patient's house. They'll be there in an hour. They're still expected to do your visit. You get this real-time communication, real-time visibility that also helps you effectively manage your caregiver's time more appropriately. So maybe you can see that for a certain week, this Thursday is going to be wide open. If you get a new referral in, you know what patient, what caregiver to assign to this new patient. You see their availability. You can just more effectively manage things with this information. So the mobile app, it's so simple, and that's the beauty of this. This is not a complicated solution that takes, months of training to get used to. These schedules can be completed, within 2 to 3 minutes the night before. You just select the date, the patient that you're going to be seeing, the visit time, and the start time of the visit. These are all customizable. If you have certain types of services you provide, we can make a drop-down specific to your organization. And this automatically creates and sends a visit confirmation form back to the user, so they have a nice queue, and they can just go through it as they do their visit the next day. It's simple. It's so straightforward, but it again solves this highly complicated challenge of just getting this information shared across all parties in the organization. Now, once the form has been sent, it's going to go into our portal where anyone with access to log into the portal at your company would be able to go there and see the daily, weekly, and monthly views of each caregiver schedule. So you'll get that, and you'll even get that real-time back and forth visibility as to how visits are going. Again, very straightforward and very nice. I also want to, just make the offer, if any of you are interested in seeing a live demonstration of this, I will have my email available at this session. So if you ever want to reach out and schedule a one-on-one demo, we're really happy to set that up for you. So again, after the visit has been scheduled, they arrive at the home and they fill out the visit confirmation form where they can confirm, cancel, or even reschedule the visit. They need to send in another appointment for another date. And these are real-time updates provided back to the central visit calendar. Now, this is where things get so exciting because doForms can really offer a one-stop shop to solve scheduling issues as well as help your organizations meet requirements, such as visit verification with GPS electronic visit verification. There is actually a federal mandate that's going into effect. It went into effect earlier this year for personal care service providers, but it will also affect all home care operators in the year 2023. So it's a really good time to start getting up to speed about all of the technologies that are available for electronic visit verification if you are in this space. And we're here to help you. We're doing a lot in this area. So doForms has an entire GPS infrastructure powering behind our application engine, and it is best in class. It uses leading state-of-the-art GPS tracking technology. I think we're even doing a couple of sessions today focusing specifically on GPS. So if this is of interest to you, I highly encourage you to check out those. But from a healthcare perspective, our GPS tracking technology allows you not only to track the caregivers as they move around in real time, So you can actually see where they're going when they're stopping at a certain location. You can get status alerts as to what's going on at a specific visit. You can really watch a map move as they go throughout their day. You can see their routes. You can figure out who's good for the next visit. It's really neat stuff. But we also give you the ability to GPS stamp where a form is being completed. So in the case of visit confirmation, visit verification of your home care visit, this becomes critical. And the reason for EVV, if you take a step back, is that there was a tremendous amount of fraud being done in this space. Home care companies were saying that they were providing services. They were billing Medicare and Medicaid for these services, but they weren't actually doing them. And until the electronic visit verification mandate came out as a part of the 21st Century Cures Act a few years ago, there was no mechanism in place that required home care agencies to provide proof. So EVV is here to help ensure that we're getting proof that a visit is done. So it requires that we capture the date of service, the type of service, the individual receiving the service, the person who provided the service, the time it started and ended, as well as the location of service. So with doForms GPS engine, we're able to, in this visit confirmation form, automatically track and stamp where your visit confirmation is taking place. We also have the ability to immediately alert a supervisor if you clock in somewhere that is outside of a specific range of where you're supposed to be, just based on the patient's address. So if I'm supposed to be receiving care at 100 Central Avenue, and my nurse, checks in at, 800 First Avenue North, it's 5,000 feet away, I'm going to get an alert saying I'm not at the right place. And that's called a location exception alert. And that's really important. I would say that there are cases of, not so much in the skilled nursing side of things, but there are cases of people saying they're doing jobs when they're not. And this provides you proof of jobs being done at the right location, as well as proof to provide the government, if you're ever audited, that you know exactly where these visits are being maintained and they're at the right location. So yes, so we can verify the visit location, we know where it is, we can track devices in real time as you travel, you can see where your caregivers are, and this is really nice. We can also automatically calculate the mileage that's being traveled. So instead of having to do manual mileage reports, little charts on paper every week, this can be automatically calculated for you. So it's really nice and accurate. So you get that proof and you know exactly that you're reimbursing for exactly what was really done. So our GPS tracking and visit verification on top of our self-scheduling solution is solving so many challenges for home care companies today. I'll just make sure this is working. Now, we were talking about skilled nursing and the issue that they have. Not most, but many home care companies offer two different service lines. And if you're in the space, of course, you're familiar with this: skilled service and personal care service. The personal care sector deals with home health aides. And they actually are those who go in and they do tasks like bathing and grooming and housekeeping and shopping and errands. And they're unskilled tasks, but they're critical to helping take care of patients in their home. Now, what's unique is that home health care aides, they're typically scheduled in the traditional sense. You'll tell them where they need to be at a certain day. So with doForms, you actually have a whole platform to meet the workflow requirements of any sector of your organization. So if you wanted to dispatch out a timesheet to a home care aide and make sure they fill that out every day, when they're doing their scheduled visits, that can be done. But if you want to allow the caregiver to self-schedule, that can also be done. And all of this can be integrated into a single dashboard view so you know exactly where everyone is, what's going on in real time. It's beautiful. So exactly, agencies can see a unified platform to manage your home health aides, use dispatch to send and schedule jobs. They're traditionally scheduled by the main office and they receive their timesheets, and these timesheets can be filled out on a daily basis or a weekly basis if they prefer to do it that way. So you get these timesheets back into the office, it's fully automated and saves you a tremendous amount of time. And I do want to highlight our weekly timesheet solution for home health care at this point as well. This is something we are seeing deployed all throughout the United States. It's simple, it's turnkey. It's something that most home care agencies are using, and many of them are still using paper timesheets for their home health aides. What we do at doForms is we just ask that you send us a copy of your existing weekly timesheet. We build it for you in our form builder tool. We make it look exactly like the paper version your caregivers are used to using. And what does that do? So most healthcare systems, when you introduce a new technology, you're going to ask people to kind of change their process. You're going to say, all right, we're going to start using this. Now you need to learn how to fill out your paperwork this way. doForms flips that on its head. And we say, hey, we know you're used to filling out the timesheet that looks like this way. We're going to do it. It's just going to look exactly the same. It's going to be on a tablet and you're going to fill it out. It's so easy, and all the caregivers can learn how to do it in just a matter of minutes. We've actually won significant deals based on the fact that our system is so easy to use and adopt versus other healthcare systems out there. The caregivers actually self-select, saying, this is straightforward. I want to use digital timesheets from doForms. It's so easy. I know how to do it. So training and rollout plans that are scheduled for months actually get going in weeks with our customers. So we have some great reference stories about that. And the weekly timesheet solution it's turnkey. Again, all you have to do is send us your weekly timesheet that your home health aides are filling out. We build it for you. We get you you can even trial it out for a few days, see what it looks like. And then basically they fill out their timesheet exactly as it looks like on paper and submit it to you at the end of the week. And you immediately have your caregiver's signature, the patient signature, everything you need from a compliance perspective to be sure that you have everything ticked and tied. And that takes me a little bit back to the conversation we were having about EVV and electronic visit verification. What most people don't realize is that the visit verification mandate does require the electronic verification of visits, but it does not meet the needs of all the other documentation that has to be done on a visit. So these timesheets still have to be filled out. You still have to get patient signatures on actual timesheets that fully document the task provided, where they were done, and the total hours worked on every single day. These still have to be signed by a patient or their representative. EVV systems don't fix that for you. So doForms really gives you not EVV, but what we call EVD, electronic visit documentation. So you're not subject to just a small little light app that just does the EVV pieces. We give you a full-blown one-stop shop for all of your visit documentation, including your timesheets. So you can get these signatures, you can verify visits are being done at the right place, you can get your visit confirmations on your skilled nursing side, you can do skilled nursing visit notes as well. And we give you this app that really does all of your documentation for you. So it goes a step beyond. And we even, for those of you who are using other EVD systems, so many states are providing EVD systems for free to healthcare companies. What we can do with doForms is actually call the EVD system you have in place. So it just opens right from within doForms. They clock in, it closes, they do their form, then all their other task documentation, such as capturing patient vitals, doing their charting, doing their assessments, maybe marking off what tasks they did. All of that can be done in doForms. And then they can call the EVV solution up again to clock out. They can get the patient signature on doForms and boom. So we do a seamless workflow that's integrated with their EVV system as well. So it's really nice that we can tie all of this together into a seamless, easy to use, very affordable workflow for home healthcare companies. So the real point of this is, no matter your agency's workflow needs, our healthcare scheduling systems, we have an answer, and we also have the expertise to get you automated. We've worked with dozens of companies in this specific area. We've then taken that experience and rolled it out all throughout the country. So we have thousands of visits being scheduled, every day using our platform. Being able to know what's going on with your agency, understand your unique service lines, your unique requirements. We're here to help consult you and really kind of give you an out-of-the-box solution that effectively meets your needs. So whether that be GPS tracking, visit verification tracking, doing electronic visit documentation. So maybe once you do your timesheets, you want to do your entire home care admission packet, your HIPAA consents, your incident reporting, all of that with doForms. We're able to do that. And we also offer tools for your human resource management, your assessments, your caregiver training, your employee retention programs. We have so many solutions for the home care sector that really just help you get a one-stop solution that's custom tailored for your business that helps you get where you need to go in the digital age. So with that, I'm gonna pause and just say, you know, I would encourage you all to definitely check out some of the GPS tracking sessions that we'll be doing and some of our other tracks today. We also have a neat solution on our mobile printing. So maybe you're thinking about, you know, well, I wanna go digital in home care, but I also need to leave paper copies behind with my customers. How can I do that? doForms is integrated with mobile printers, which can be carried around in a go bag. So if you need to just print something on demand, leave a copy behind, but also get your paperwork back to the office, we have a great solution for that. So we just have really exciting ecology around our entire healthcare platform. So whether it be nurse caregiver scheduling, visit verification, GPS tracking, we have the tools that you need to help get you automated in an effective, secure way. So thank you so much. I'm just going to pause and just see if there are any questions. And if not, I would just encourage you to hang on and join us for our next session, where we'll be talking about our hospice solution, which is a great solution designed for the hospice admission process and how we can help hospice agencies save thousands of dollars in automating that as well. So I don't see any questions right now. I'm going to shoot my email address in the chat. Feel free to send me an email with any specific questions if you'd like to see a demo of our scheduling solution. And we'll be back at 2 o'clock. Thank you.